My name is Karina Michelle. In this video, I'm going to be going over with you the different eyeliner techniques and which one might be best suited for you. So there are two eyeliner techniques that I offer. One is the lash line, which is also called an eyelash enhancement because it just kind of enhances the lashes. And then there's also a shaded wing. The shaded wing is basically a wing tattooed eyeliner, but it's really soft and shaded, so it's not too harsh. I'll start with the lash line, lash enhancement, and then I'll kind of go over from there. The lash line tattoo is good for all eye shapes. There's not many restrictions. It is just the lash line. It's not too thick. You really don't want to go too heavy into the eye. If you go really thick, it starts to look like a tattoo, and the whole goal of this is to really not look like a tattoo. So it's not going to get super, super thick like you might like your makeup. It is thicker on the edges typically, and then it kind of tapers in towards the nose, so it still kind of has that almond shape effect even though it is just the lash line. It really does pop on light eyes, and even though it is just a lash line, it actually does make a pretty big difference. It's very subtle. It's really good for people who are very natural with their makeup. Maybe you just wear mascara every day. If you are used to kind of digging in there with your eyeliner to get in the lashes, you'll really like this. But if you're somebody who wears super heavy makeup every day, really thick eyeliner, this probably isn't going to be for you. You're still going to feel like you need to wear makeup. However, a lot of people still like it because even though it might not replace your makeup, it is like a nice kind of base for when you don't have makeup on, just so you look like you kind of have like something there. So even if you like a lot of makeup, it could still be for you. Just kind of want you to make sure that your expectations are correct. This is not very good on people with very dark skin or very hooded eyes. So if the skin's really dark, there's not a whole lot of contrast between the ink and the skin, so you kind of just don't see it a whole lot. It might not be worth the money. Also, hooded eyes, if your skin kind of hangs over the lash line a little bit and sags, it might kind of hide a lot of the lash line, and a lot of the tattoo won't even be visible at that point. So for those two people, this might not be a good technique for you. Next, I'm going to go to the shaded wing tattoo. I want to start off by saying that this technique is extremely permanent, so just kind of really be into the wing. Make sure that this is something that you actually really want and that you're used to doing on yourself, because you're going to be stuck with it for a very long time. This technique is best on big open eyes, so very smooth, very large, and just really open. You don't want anything that's kind of closed off. Not too many wrinkles. If you have a lot of wrinkles, the wing will actually kind of fold where the wrinkle hits, so it's not going to look very pretty. Not good for hooded eyes either. Hooded eyes, same thing. It'll kind of cover the wing and just kind of droop it down. And dark skin as well, it's not going to be that obvious. However, I have done a lot of clients with darker skin, and they still like it because it might not replace their makeup, but it gives a nice cheat for them to add on their makeup easily. So it kind of gives a nice guideline. So even if you do want to wear liquid eyeliner every day, now you don't have to really start from scratch, and you're just kind of tracing your makeup a little bit, or tracing the tattoo a little bit. If you've had a blepharoplasty surgery, plastic surgery, where they actually remove the skin above the eye, this could be a very good technique for you if you've had the surgery first, because it does kind of remove the hoodedness and lift the eye a little bit, and now you're actually able to have more space to get the tattoo if there's something that you want to do. If you are younger, if you're very young, like in your 20s, we want to make sure that we keep this very conservative, because your eyes haven't aged yet. They're not going to look the way they do now forever. You know, if you're really young, we're not going to do any wing that's like super bold, super long, you know, really intense, even though that might be how you do your makeup and it might look really pretty. When you get older, this is going to sag and this is going to wrinkle, and so we want to make sure that the tattoo is really conservative and small, and that way you're able to adjust it if you need to when you get older. So this technique is it's a very small and a very subtle way to do a wing for makeup. It might not replace makeup, you know, 100% either for most people. It's very subtle and very soft, so it's very pretty without makeup, which is part of the reason why you want to do this. If you go really heavy and fill it in completely solid, the wing, it tends to look like a tattoo. And then when you don't have makeup on, it looks a little weird, and then after, you know, 10-15 years, it's going to kind of look a little odd. I like to keep the shading really subtle and really soft, and that way nothing ever looks kind of crazy. I personally have mine done. I've had it for probably like 4 or 5 years, and I'm kind of to the point now where I just darken it with makeup, and it takes me 2 seconds because I already have a perfect wing there, and I'm just tracing it. Like I said in some of my other videos, this is not necessarily a 100% replacement for makeup. This is more of a permanent enhancement that you can use to build your makeup on, or just be a nice kind of subtle enhancement if you're someone who doesn't wear a lot of makeup. One other thing to mention, we cannot tattoo the corners of the eyes. So either the inside corner or the outside corner, we cannot tattoo at all. And I know a lot of people, they kind of like their tattooed wing, or they like their eyeliner wing to be really in the corner and low, that extends up. We can't hit the skin there because it's actually a different texture, and you're more of risk of migration. So we can only tattoo all the way to the last lash line. So if this is something that you like to go way down here, just know that the tattoo is not going to do that. How long does the procedures take? The lash line will take about an hour and a half-ish, and the wing will take about 2.5 hours. The lash line, there's not really any pre-drawing because it's just the lash line. We kind of just go right into it. And then the wing, we actually will pre-draw the actual wing on to make sure that it's in the right spot. Once we get everything perfectly approved, then we'll actually start the tattoo process. Does eyeliner tattoo hurt? I would say not so much. It actually does get numb. So the lash line we do pre-numb. We let it sit for about 10 minutes. It numbs really well. And then as I work, I usually add more numbing. So it's not so bad at all. The wing, I kind of mark the under the wing before I do any numbing, just to make sure we lock in that direction. And then after I get that little line done, then I throw the numbing on. So that one you're gonna feel a little bit, but it's really quick. It's like 10 seconds, throw the numbing on. After that, you don't feel anything. So I would say neither technique is very painful. The one thing I always tell people about eyeliner is that it's not painful, it's just annoying. It's kind of just like one of those things where I'm putting pressure and I'm rubbing and I'm doing a lot of wiping and stuff. So it's not fun to have someone mess with your eye for a long time, but it's not painful. It's more so just annoying. So now you have your eyeliner tattoo appointment booked and you've chosen your technique. Here's some things to remember before you come in for your appointment. No blood thinners for 24 hours. So no coffee, no alcohol, no pain medication, fish oil, or vitamin E. Don't come with any makeup on. Make sure you kind of wash all your eye makeup on before you come in because you don't want to have to have any like stuck mascara or anything from the night before. You cannot have eyelash extensions on. So I would say have them removed maybe like 3 to 4 weeks before your appointment, just to give your eye some time to kind of rest before you come in. And I would wait at least 4 weeks after your tattoo to be able to put them back on. No contacts for about 5 days, I like to say, just because you really don't want your eyes to be very wet and you don't want any saline from the solution to get in the eyes. So just kind of try to wear your glasses for a few days, give your eyes some time to rest. You must be off lash growth serums for a minimum of 6 months to get the eyeliner tattoo. They make the skin very sensitive, and if we try to tattoo it, it'll just bleed and swell and the ink's not going to go in and it's just going to be bad for everybody. Now I'm going to go over the aftercare for your eyeliner tattoo. So taking care of your eyeliner tattoo is actually fairly easy. You really don't do much. It's more about what you don't do. The biggest thing is just don't wear any makeup for 1 week. So nothing around the eyes at all. No mascara, eyeshadow, not even concealer. Just really stay away from any makeup. You don't want any bacteria getting into the eyes and making it swell up and get infected. Keep the area dry for 24 hours. So after your appointment, just try not to wet the eye, just kind of give it a chance to kind of settle down first. Every time it gets wet after that, just dab it dry with a clean tissue or gauze. It will be a little bit swollen, a little poofy, nothing crazy. It's really just like maybe you were crying or have allergies or something. It can last a few days, that's normal. It tends to kind of go away throughout the day, and then when you wake up in the morning, because all the blood rushes to your head when you sleep, it kind of gets a little poofy again. So if you wake up with poofy eyes for a few days, that's totally normal. You might have some minor flaking. The flaking for the eyes is really pretty small. It's usually not very intense. It's so small you might not even see it, but sometimes the lashes will kind of hold onto the flakiness and then it'll come off in a strip. So if that happens, just don't pick it, just kind of leave it alone and let it do its thing, but usually it's not very intense for anybody. Try to stay away from anything salty. This goes for really any tattoo technique. Anything saline will actually remove ink. So just make sure you're not using any eye drops for the first few days because sometimes they have saline in it. Stay away from your contacts for about 5 days. No sweating, anything salty in the sweat can remove it as well. If you ever gets wet, just make sure you're kind of dabbing it dry. And another one that's kind of awkward to tell people, but just try not to cry for like the first week because the salt in the tears will do the same thing. And that's inside the eye too. So if you're crying, all that salt will just like remove the lash line tattoo like right away. Make sure you're not using any lotion, soap, or anything around the eyes either. So just very minimal. If you feel like they did get dirty for some reason, just kind of flush your eye with water and then dab it dry immediately. Try not to use any soaps or lotions anywhere near the eyes. In your aftercare kit, you will have a instruction booklet. The eyeliner section is very small because you don't really do anything. It just kind of talks about briefly what I just went over. Don't wet it for 24 hours. Try to keep it dry. If it gets dirty, just kind of flush it and then pat it dry, and that you might be a little bit swollen for a few days. On this side, you'll still see the rules. The rules apply to everybody. Don't go swimming, don't go anything that's gonna get bacteria in the eyes. Make sure you're not picking anything. Stay away from the sun. Still sleep with a clean pillowcase just in case. And stay away from anything that's going to get the eye dirty. With all procedures, there are risks, so I wanted to go over some of the risks with eyeliner tattooing. So one of them is migration, which is basically when the needle, if it hits the vein above the eye, the ink will kind of travel up the vein and leave a little black spot. This is very, very rare. It's more so on really, really thin vascular skin, but when it happens, typically we can just push it out anyway, so it's not a huge deal. Corneal abrasion is another risk. Just basically, it's like a little scratch on the cornea. It is extremely rare, but and it's not from the needle. The needle goes nowhere near your eyes. More so just from like all the rubbing and cotton and ink and stuff. Sometimes it can irritate the cornea. I always make sure that before I get started, I put in drops that are like a gel. And these gel drops, they kind of just coat the eye first and just protect it from anything. And lastly, just like with all tattoos, there's always a risk of infection. So just make sure you're always following the aftercare instructions and making sure you're keeping everything nice and clean. As a reminder, I wanted to just kind of mention the people who cannot get permanent makeup. As always, you have to be off the lash growth serums for at least 6 months. If you have glaucoma or any eye problems, you cannot get this done. If you are pregnant or nursing, if you have been on chemotherapy or Accutane the past year, if you have been on antibiotics in the last 3 months, hemophiliac, certain immunodeficiency disorders, and autoimmune diseases will require a doctor's note of approval, and this includes diabetes. I hope that this video answered all of your questions about eyeliner tattoos, and if you have any more questions, please feel free to visit my website with more information.